Welcome to the Post-Operative Pain Management with Elastomeric Pump lecture from the Department of Anesthesiology, Baguio General Hospital and Medical Center. Although the elastomeric infusion pump delivery system by Bibron or Easy Pump was solely mentioned in this lecture, no form of incentive was received nor requested from the company. The data presented are those practiced and upheld by the BGHMC Department of Anesthesiology. Last 2020, the International Association for the Study of Pain, or IASP, introduced a revised definition of pain, which is the result of a two-year process that the association hopes will lead to revised ways of assessing pain. The definition is an unpleasant sensory or emotional experience associated with or resembling that associated with actual or potential tissue damage, and is expanded by the addition of six keynotes for further valuable context. 1. Pain is always a personal experience that is influenced to varying degrees by biological, psychological, and social factors. 2. Pain and nociception are different phenomena. Pain cannot be inferred solely from activity in sensory neurons. 3. Through their life experiences, individuals learn the concept of pain. 4. A person's report of an experience as pain should be respected. 5. Although pain usually serves an adaptive role, it has adverse effects on function and social and psychological well-being. 6. Verbal description is only one of the several behaviors to express pain. Inability to communicate does not negate the possibility that a human or a non-human animal experience pain. Post-operative pain is considered a form of acute pain due to surgical trauma with an inflammatory reaction and afferent neuronal cascade. It is a constellation of several unpleasant sensory, emotional, and mental experiences caused by the surgical trauma and is associated with autonomic, endocrine metabolic, physiological, and behavioral responses. Recent literature has recognized that post-operative pain can be divided into acute pain and chronic pain. Acute post-operative pain is experienced immediately after surgery up to 7 days. Acute pain that becomes intractable and persists for more than 3 months after surgery is referred to as chronic post-surgical pain. Acute and chronic pain can arise from cutaneous, deep somatic, and visceral structures. Acute postoperative pain plays a positive role by providing a warning of tissue damage and inducing immobilization to allow appropriate healing. The negative clinical outcomes arising from undertreatment of acute postoperative pain are summarized in this table. These outcomes result in the extended hospitalization, higher healthcare costs, and reduced patient satisfaction that ultimately negatively affects the patient's quality of life and functional recovery. It also increases the risk of post-surgical complications and the risk of persistent post-surgical pain. In addition, poorly treated acute pain may exacerbate the underlying pathophysiology of many illnesses and injuries. One of the solutions to control postoperative pain is to use an elastomeric infusion pump delivery system with an epidural catheter. From this point onwards, the elastomeric pump that would be mentioned would be the one available in our institution, the Easy Pump. The elastomeric infusion pumps are designed to give clinicians and nurses the option of delivering predetermined amounts of medication to the patient in a continuous and accurate manner. Medication is delivered to the patient by positive pressure applied by the elastomeric membrane. The flow rate is determined by the combination of the flow regulation device or flow restrictor and the positive pressure of the elastomeric membrane. This pressure delivers the solution against the back pressure of catheters and blood pressure of the patient's veins. Epidural infusion is a specialized analgesia technique managed by anesthesiologists. The epidural infusion, a local anesthetic, with or without additives, is prescribed only by anesthesiologists together with the infusion rate in ml per hour. The level of insertion of the epidural catheter, the catheter position of the skin, and the skin to space distance are recorded on the intraoperative anesthesia record. Epidural analgesia is often used to supplement general anesthesia for surgical procedures in patients of all ages with moderate to severe comorbid disease, to provide analgesia in the intraoperative, postoperative, and peripartum and end-of-life settings. Research upholds the use of epidural analgesia for diagnostic procedures, acute pain therapy, and management of chronic pain. Epidural analgesia may also reduce the surgical stress response, the risk of cancer recurrence, the incidence of perioperative thromboembolic events, and possibly the morbidity and mortality associated with major surgery. The easy pump is intended to infuse medications for either continuous, intravenous, subcutaneous, or epidural infusion. Chemotherapy, antibiotics, anesthesia, and IV pain management are the most common therapies. Elastomeric pumps are contraindicated for the delivery of blood, blood products, insulin, total parenteral nutrition, lipid emulsions, and life-saving drugs or catecholamines. Easy pump is not also for intra-articular use. The easy pump does not require power cords, batteries, or IV poles. It also has air elimination filter and particulate filter. Air bubbles in the silicone sleeve will not affect the functionality of the pump, and there is an air vent in the filter which is capable to filter out the entrapped air bubbles. The silicone sleeve has the properties of gas permeability, therefore the air entrapment in the silicone sleeve can be diffused out of the pump. Fixed flow rate design does not require programming or drop counting, and transparent balloon construction to help facilitate easier inspection for particulates. Components are not made with natural rubber latex or DEHP.
A number of pain assessment tools have been validated for accuracy in detecting the presence of and quantifying the severity of pain and have been tested for intrapatient and inter-rater reliability. Here is a recommended tool for assessment of post-operative pain. Pain assessment helps determine whether pain management is adequate, whether analgesic or analgesic dose changes are required, whether changes in the post-operative pain management plan or additional interventions are warranted, and in the case of difficult to manage pain, whether specialty consultations or other measures are needed. Because pain is inherently subjective, patient self-report is the primary basis of all pain assessments. Although assessments of pain behaviors might supplement information from self-reported pain, it is important to interpret behavioral observations cautiously.